Hi, everybody, and welcome to this interview. I'm so thrilled to have Sean Bauman with us today from IMMY. I know many of you were looking forward to a Facebook Live event. Sadly, even in the high-tech world we live in, occasionally we have challenges with technology, and for whatever reason, today Zoom was not wanting to connect with Facebook Live. So we are going to record this, and then we'll just post it on Facebook, and you can go back and watch it all the time. Certainly, if you've got questions for Sean, you can put those in the notes, and I will do my best to relay those to him at a later date. But Sean, thanks so much for joining me today. I really appreciate it.
Well, thanks, Scott. Thanks for having me. Look forward to chatting with you and telling you about some of the exciting things that are going on right now.
Hey, thank you. And you know, IMMY has really stepped up. I've been really thrilled to tell people about your company, your business, and the work you do. I've talked about that we have a local business who is fighting a global pandemic. And this is not really new territory for you guys, but I don't think a lot of people really fully appreciate what you do day in and day out long before we ever knew about COVID-19. So before we get into the particulars about the pandemic we're in today, why don't you give everybody a little bit of history and background about IMMY?
Sure. Yeah, thanks. We've had, like Scott mentioned, we've had a long record of trying to help people get diagnosed earlier, faster, wherever they are. We've learned a lot of lessons through some of our experiences abroad, particularly in Africa, the challenges of delayed diagnosis. And we've really kind of set a high bar for ourselves that we want to develop tests that can be run under a tree anywhere in the world. And so we always imagine an acacia tree out in the African savanna that we're able to diagnose somebody with an infection with nothing other than a quick test out in the middle of nowhere. So the bar is high, and we've been battling fungal infections primarily all across the globe, manufacturing diagnostic tests that we sell to hospitals and clinics all over. And that has allowed us to develop a network of incredible clinical partners that don't just study fungal infections or treat just fungal infections, but they treat infections, period. And so that's actually something that we really stand on as kind of a foundation as we dove into this COVID type situation.
Now, tell me this, how long has IMMY been in operation, and where did you get your beginnings?
So yeah, we were born in a barn in Goldsby, Oklahoma, in the middle of 200 acres that my grandfather had. And he gave it to my dad and started a business in a room about 15 feet by 15 feet inside of the barn. So it started very, very, very humble beginnings. And we really have tried to maintain a connection to our roots, being a family started company. Family is very much a part of the culture of our company today. It's not a requirement, but we all eat lunch together just because everybody enjoys spending time with each other. And I always get a huge smile on my face when I walk into our lunchroom and you see, 8 to 10 people crowded around a table for 4, just because this is pre-COVID. I should say that's pre-COVID. Post-COVID, we've actually removed about 3/4 of the chairs out of our break room just to enforce social distancing.
Now, typically in the past, when I might try to connect with you, either call you or text you, I was never sure exactly where I might be finding you. As you mentioned, you're working all over the globe, and so what's it been like personally for you, just having to, with travel being shut down? How's that impacted your business?
Yeah, so it's been a big challenge. We're actually in the middle of launching a brand new product in Europe, and so Europe's not doing any new anything unless it's got COVID in the name, and so really none of that is happening. And we had the opportunity to pivot during this time instead of just binge watching on Netflix. That sure I enjoy doing that at times, but we were able to jump to the call and help out where we could. But it's definitely been a challenge. I'll tell you, we pride ourselves on really manufacturing our products from the raw materials on up. So we really outsource very little of our manufacturing. But still, our suppliers are global, and with supply chains being pinched, that has been a challenge. But we fortunately we have pretty robust supply lines and have alternate vendors and different pathways. People have gone out of their way to continue the supply of raw materials to us, so we've been pretty fortunate in that regard.
So talk to us about that pivoting. Tell everybody how you guys have transitioned from what you were typically doing to how you're, head on addressing the COVID-19 crisis that we're in.
So we're all about trying to move diagnostic tests closer to the patient. So what that does is that reduces the turnaround time. Imagine, as an example, so a pregnancy test is a diagnostic test, but imagine you had to send off to some central lab in Washington D.C. to get the answer to that test, right? I mean, that seems ridiculous nowadays, right? You hop over to Walgreens or CVS or Walmart or someplace, and you buy a pregnancy test, and you find out whether or not you and your wife are pregnant for the first time, and that's the type of thing that we envision. We want to see tests that are moving, not just at reference laboratories or just this hospital in the state, but push it all the way down as far as we can in the healthcare chain. And where it makes sense, let's find a way to push it into people's homes, to where they can diagnose themselves with certain conditions right in their own home. And so we were talking to the local hospitals, Norman Regional, and the folks up at OU Medicine, and they're just talking about the challenges with turnaround time. So how long it's taking once they send a sample off to get the results back for a particular patient. And you can imagine the whole time that they're waiting on a COVID result, all of the PPE equipment that gets taken off and thrown away by countless people all the time, every day. Including your food delivery staff. I mean, it is a tremendous amount of PPE, and that's actually something that is in very short supply. So we decided we had some of the equipment, we had the know-how, we had the smarts and the skills to be able to dive into this. And so really, we just decided to do it. And we went from an idea to reporting our first test result in 10 days, which that means an idea, starting a company, hiring a medical director, setting up a clinical laboratory with all the procedures that are required for all of that, doing validations to make sure the test is performing correctly. And we did that in 10 days. Now, that was because of a lot of different things, okay? Great partners at Norman Regional Hospital. They were helpful very much. The Oklahoma State Department of Health, we could not have done it without them really essentially holding our hands through this process to become a certified high complexity CLIA laboratory. And then now we're one of the preferred testing partners for the state of Oklahoma. One of a very few in the state that are performing these tests on a daily basis. So it's been really remarkable. It's really, I think, a testament to what can happen when people are pulling the same direction on the rope. And it's people not just inside the walls of IMMY, but outside, that such generosity, I'm telling you, from a friend of mine, Dr. Jimmy Ballard, is the chair of the microbiology department at the Health Science Center. I called Jimmy up and I said, hey, do you have this certain type of piece of equipment? And he said, yeah, hang on, I'll call you right back. And he called me right back with the authorization to loan me this piece of equipment. And he also sent a postdoc down to help set it up. I mean, just remarkable generosity there by him. The faculty and staff at the microbiology department in Norman have just been so generous with their outpouring of support. I mean, when I said, hey, I don't have a certain chemical or certain this or that, you would not believe the people that just said, hey, here's what I have in my lab, take it if this can help. And very much a team effort to make that happen, to get us initially just off the ground and running. And I just can't say thank you enough to everybody who's been a part of that.
Well, you're making a huge difference. And I want to give you some kudos also, because you were one of the impetuses behind the chamber, the hospital foundation, the county partnering together to collect PPE for healthcare professionals. And that's been going like gangbusters. So I'll put a plug into that for everybody that's watching this. Monday, Wednesday, Friday from 3 to 5. If you have any of the PPE, personal protective equipment, that is listed on the Chamber's website, normanchamber.com, please make a donation. The hospital can still use that equipment. And if you don't have any sitting around, make a financial contribution to the foundation, because they're doing great work to equip the healthcare providers that are on the front line of all this. So thanks for suggesting that and letting us be part of that endeavor. It's been great.
No, I'm so excited that the business community has really stepped up in a big way to help our healthcare providers locally, because without them, we're in not a good spot at all. So we've got to keep them healthy and safe, and they'll do the same for us.
Absolutely. Well, and that's the great thing. That's one of the things I love about Norman, is that I think partnership is probably one of our founding principles and key words in our community. Partners come together to solve problems, and that's what we've done. And this has been great. So tell us about these tests that you guys are looking at. I assume you don't want me to come by the IMMY office to be tested, right?
No, that won't get you very far. There's signs all over the place. We keep the place locked down right now, pretty tight, just because we need to keep our staff safe and healthy, really. I mean, because during all of this, we made the commitment we're going to continue to serve our customers all across the globe with our normal tests, but we're also going to do this COVID testing as well. And we're going to do both with excellence. So, but don't come to our office to get your blood collected or for a swab. That's not the place to do it. You need to go to your healthcare provider for that. And in very short time, we'll be able to announce some of our partners, namely some of the urgent care clinics, in addition to all the hospitals that you could normally go to. But the hospitals we don't want healthy people going to the hospitals, or we just don't want them. They don't need to go there unless it's an emergency situation. So we'll be able to announce that very, very soon. Now, we've done some pilot testing for our newest test. So most people have heard about the swab test. This is the test that's put up your nose. And that tells you if you have the virus or not, like right at this moment. The test that we just launched yesterday is a test that tells you if you've had an immune response to the virus. So there's certain times during the course of an infection where both tests are important to be able to determine what stage of disease you're at. But it also is helpful to know, have I been infected with COVID-19? The reason that's important is that some places will use that information. I'll tell you, healthcare providers, every one of them wants to be and have antibodies to COVID-19, okay? Because what they believe, and I personally believe, is that it will confer immunity. Just like when you get a vaccine, it confers immunity. It has not been proven yet. So our test can't make any claims that it proves immunity. I want to be real clear on that. But I hope I have antibodies. I don't right now. So I believe that I'm at greater risk for infection than somebody who would have antibodies. So I think what you'll find is, particularly in a healthcare setting, that people that have antibodies will volunteer to be on the front lines with the sickest patients. They won't be forced to, but they will volunteer because they believe that they have a level of protection that their colleague may not have. So that's actually an exciting test. That, again, there's lots of people that want this test. Lots of employers want this test for their staff to find out, hey, when can folks go back to work? There's unclear guidance right now on what all that means, but it's coming. We're learning as we go on this. Maybe I can pivot and I can show you a few things that some folks have been working on to help make sense of some of this.
That'd be great.
But first, a message from our platinum sponsor for the chamber. Can you see the Flowbee?
I can.
Yes.
It's great.
And you can see I need the Flowbee badly. But it is, I really think Flowbee would be doing good business right now.
Yeah.
No, in all seriousness, let me get to this. So one of my epidemiologists put this time-lapse video together of the epidemic. And so this is starting at the beginning, I believe at March 6th, and you'll see it kind of step through, of what the epidemic has looked like in Oklahoma. And you'll start to see that the metro, Oklahoma City Metro and the Tulsa Metro are hot spots, but so is Cleveland County, right where we live. And eventually there'll be cases in every county. It's just a matter of time. This disease is pretty easily spread. So that's looking backwards. And a lot of times you'll hear, White House press releases. Governor Stitt yesterday showed some data from this particular website, which has, this is modeling what the epidemic is projected to look like. I believe yesterday the peak was April 28th. Now it has moved to May 1st. This is an imperfect model, as are any model that you have, but it's doing its best to try to estimate when the peak burden on our healthcare system will be. And you can see right here on April 30th or May 1st is the peak number of actually deaths in a given day, that's actually substantially less than it was about a week ago. This number was up in the 60s a week ago. It was up in the 60s a week. What's that, Scott?
What do you attribute the less number to?
Well, I don't know for certain, but I think definitely our social distancing is helping that out. And I think that's to a large degree, that's helping flatten this curve. I think by flattening it, what we do is we're spreading it out. So I think it's hard to say when we'll open back up, right, for business, but hopefully we can smash this down as far as we can, and we can start to find ways to get back to work in a safe way. Everybody, we need to find a way to get back to work in a responsible, safe way in order to not allow for kind of a second wave of an epidemic that some people have talked about.
So right now, how many tests are you guys reviewing every day at IMMY?
So every day is a little bit different. It depends on, we're adding new customers all the time. I think peak number of tests that we've run in a day is almost 200 and something, I don't remember, in a given day, which for us to go from nothing we ran 20 on our first day. And we were really, really excited on that first day. And I still remember, it was 2 a.m. and we were all pretty happy when everything worked right and we were able to report results. We're not taking on a tremendous number of clients either, because we're really priding ourselves on being able to have fast turnaround time. So I'll tell you what Norman Regional has. A lot of other places in the state do not have this, that we turn around test results in a matter of hours. So this is allowing for surgeries that may not have happened to happen in a very timely manner. There's at some point, elective surgeries become not elective if you wait a certain amount of time. And so they've got to be able to perform some of the surgeries on patients that are in desperate need of these things, but doing them in a smart way. Another thing that Oklahoma is set up to be the first state to have both of these tests, both the swab test and the blood test, as we move towards the peak of the epidemic. And so we'll be able to see kind of where we're at all along the way and which population of people have already been infected. And not that you don't need to use precaution if you've been infected and you have antibodies, but you're at less of a risk. And so really Oklahomans and Oklahoma healthcare providers will be able to use these two new tools together to be able to build new algorithms for helping to decide which patients have surgeries, which patients are safe to have surgeries, those types of things. So we'll be, ahead of the game, ahead of any other state in that regard. And we're already set up to do wide scale testing for antibodies. I believe we made 100,000 tests yesterday. So we have the materials to make 1 million tests in-house. So we're scaled to make a lot of tests available to a lot of people, and we're going to serve Oklahoma first.
So how would that look? Because right now we're having a lot of conversations about how do we reopen the economy in a way that is safe. I mean, first and foremost, we do not want to contribute to the problem. The business community does not want that to happen. But we also know that these are jobs, lives are on the line when people can't make any kind of income anymore. And so people are anxious to get back to work. So what does that look like for a business, whether it's like yours or I've got 7 employees at the chamber, businesses like ours? What would it look like for my staff to go get tested to ensure that they get the stamp of approval, right, safe to go back to work?
So we're hopeful again to announce in the very, very near future, meaning this week, the next day or so, some of our partners that are talking about setting up drive-through blood testing sites. We've heard about the drive-through swab sites, which we have those in Norman now as well, which those are important for sick people. These drive-through sites would be for healthy people that presumably have recovered from a COVID infection. So if you have symptoms, this is not the test for you. If you have symptoms, you need the swab test. Okay, so really you got to think about it as 2 different tests. The swab test is if you have symptoms. The blood test is when you don't have symptoms and you've recovered. So drive-through blood testing sites, urgent care clinics. I know there's lots of hospitals that are very, very interested in this very thing. So I think you're going to see a lot of places open up really quickly that would give Oklahomans the opportunity to be tested in a very, very big way.
That would be awesome. And I think that's probably also our government officials who are making these heavy decisions about when to open back up or continue to shelter in place. They would love this kind of information and knowledge, right, as we open back up the economy. Well, Sean, is there anything else you want to share with the viewers today?
No, I just say, stay social, keep social distancing. I think that's the right thing right now. Find a way to support your local businesses, get some takeout food, get on the Norman Regional Foundation page, and figure out what they need. Those are ways that you can help. There's so many ways that you can help. Reach out to a neighbor that you haven't seen in a while. I think, especially some of our elderly neighbors, that we need to be keeping in touch with them and making sure they have the things that they need. Those are the folks that offer to go to the grocery store for them. Those types of things. It's just doing what Norman folks do, right? Helping each other out. So let's just keep doing what we do.
Amen to that. And I would encourage people to, Sean mentioned the hospital foundation. They would so appreciate your help. Our local United Way, I know they're accepting donations for people who need rental assistance or utility assistance. And then if you're looking for a way to engage safely with the economy, go to Together for Norman Biz. That's a Facebook group that we've created. And so a lot of businesses are posting their daily specials and different things they're doing for customers. And so it's a great way for the consumer to see how they can safely engage local businesses. And then we will be having more of these Facebook events. While this was recorded, we hope to do another Facebook Live event tomorrow. And then on Thursday, we've got an interview set up with Richie Splitt, our hospital administrator, Thursday morning at approximately 11 o'clock. So we'll hope to be live with him. But in the meantime, Sean, thank you so much for making time for us today. We greatly appreciate it. Please share our well wishes and thanks to your staff. They are working overtime and trying to keep all of us safe, which we really appreciate.
Thank you very much. Yeah, big shout out to my team. They're a bunch of rock stars. Thank you.
They are. Well, Sean, thanks so much, and thank everybody for joining us today. We'll see you real soon.